Welcome to today's flashcard review on gastrointestinal drugs. Let's dive into some key medications used to manage digestive system. The first class to talk about is antacids, with cells producing hydrochloric acid, which contributes to the stomach's acidic environment. An antacid tablet entering the acidic environment reacts with hydrochloric acid in the stomach. The diagram includes a pH scale, demonstrating how the reaction raises the stomach's pH from highly acidic to a more neutral level. The increased pH leads to decreased activity of pepsin, an enzyme that requires an acidic environment to function effectively. These are relief of heartburn, indigestion, acid reflux. Purpose is to neutralize stomach acid. Onset, rapid, within minutes. Major side effects are constipation, diarrhea, electrolyte imbalances. Examples are Tums, Malox Rolaids, Gaviscon, Mylanta. Here's Mnemonics flash review of antacids. Tasty relief gives mommy moments. Next class to discuss is proton pump inhibitors. The diagram shows a section of the stomach lining, focusing on the parietal cells, which are responsible for secreting stomach acid. Proton pumps are located on the surface of parietal cells. They work by exchanging potassium ions K+ from the stomach into the cell and pumping hydrogen ions H+ into the stomach, which leads to acid production. PPIs, such as omeprazole, bind to the proton pumps on the parietal cells. This binding inhibits the pump's action, preventing the exchange of ions and thus reducing acid production. PPIs are used for the treatment of GERD, peptic ulcers, Zollinger-Ellison syndrome, and erosive esophagitis. Purpose: they work by reducing stomach acid production by inhibiting proton pump in the stomach lining. Onset: the full effect of PPIs can take several hours to days. Side effects: nausea, diarrhea or constipation, headache, and abdominal pain. Examples of proton pump inhibitors: omeprazole, Prilosec, esomeprazole, Nexium, lansoprazole, Prevacid, pantoprazole, Protonix, rabeprazole, Acip-Hex. Here's Mnemonics flash review of PPIs. Our educated learners prefer rabbits. Next class to discuss is H2. Here's an explanation of the diagram. The parietal cell membrane contains H2 receptors, which are targeted by histamine. Histamine binds to the H2 receptor on the parietal cell membrane and activates a G protein inside the cell. The activated G protein stimulates adenylate cyclase, an enzyme in the cell membrane. This enzyme converts ATP into cyclic AMP, which activates protein kinase, which plays a key role in further cellular signaling. pKa phosphorylates and activates proton pumps on the parietal cell membrane. Activated proton pumps secrete H+ ions, contributing to acid production. An H2 receptor antagonist, e.g. ranitidine, binds to the H2 receptor, blocking histamine. Thus reduces CAMP production, decreases pKa activation, and ultimately inhibits the proton pumps, leading to reduced stomach acids. These medications are used for treating conditions such as gastroesophageal reflux disease, GERD, peptic ulcers, Zollinger-Ellison syndrome, and erosive esophagitis. Purpose: the primary purpose of H2 receptor antagonists is to reduce stomach acid production by blocking the H2 receptors on parietal cells. Onset of action: H2 receptor antagonists generally begin to work within 30 minutes to 1 hour after oral administration. Common side effects include headache, dizziness, gastrointestinal disturbances such as diarrhea or constipation, and fatigue. Examples of H2 receptor antagonist are ranitidine, Zantac, famotidine, Pepcid, cimetidine, Tagamet, nizatidine, Axid. Here's Mnemonics flash review of H2 receptor antagonist Can Fred Not. The next class to discuss is Prokinetics. The diagram shows the stomach and small intestine as the primary areas where prokinetics exert their effects. Prokinetic drugs act on the enteric nervous system, specifically targeting serotonin 5-HT4 receptors. The drugs stimulate 5-HT4 receptors on enteric neurons. This stimulation leads to an increased release of acetylcholine, which promotes muscle contractions in the gastrointestinal tract, enhancing motility. Prokinetics help promoting faster gastric emptying and stronger contractions, prevent the backflow of stomach contents, reducing the risk of reflux. These medications are used to treat gastroparesis, GERD, functional dyspepsia, and irritable bowel syndrome, IBS. Purpose: the primary purpose is to slow gastric emptying and reflux. Onset of action: prokinetics generally begin working within 30 to 60 minutes after administration. Side effects: common side effects include diarrhea, abdominal cramping, nausea, and fatigue. Domperidone, cisapride, propulsid, prucalopride, Resolor, erythromycin, used off-label for its prokinetic effects. Here's mnemonics flash review of prokinetic. Next class to discuss is laxatives. Laxatives are substances that help stimulate bowel movements or soften stools to relieve constipation. There are several types of laxatives, each with a different mechanism of action. 1. Bulk-forming laxatives absorb water into the stool, increase stool bulk, example, psyllium. 2. Stool softeners, emollient laxatives, allow water and fats to penetrate the stool, soften the stool for easier passage. Example, docusate sodium. Osmotic laxatives draw water into the intestines via osmosis, increase stool moisture content and volume. Example, polyethylene glycol. Stimulant laxatives stimulate the intestinal wall nerves, increase muscle contractions in the colon. Example, bisacodyl. 5. Lubricant laxatives coat the stool and intestinal lining with a slippery layer, facilitate easier stool passage. Example, mineral oil. 6. Saline laxatives contain ions like magnesium or phosphate, attract water into the intestines. Example, magnesium citrate. 7. Chloride channel activators activate chloride channels in the intestinal lining, increase fluid secretion into the intestines. Example, lubiprostone 8, guanylate, cyclase C agonists, increase cyclic GMP in the intestines. Enhance intestinal fluid secretion and motility. Example, linaclotide. Next drug to talk about is antidiarrheals. Antidiarrheal medications' primary goal is to restore normal bowel function by either slowing down intestinal motility, reducing fluid secretion, or treating the underlying cause, e.g., infection or inflammation. Common types of antidiarrheals. 1. Loperamide Imodium mechanism. Slows down gut movement, allowing for more water to be absorbed. Uses acute diarrhea, traveler's diarrhea, and sometimes chronic diarrhea. 2. Bismuth subsalicylate, Pepto-Bismol mechanism. Reduces inflammation in the gut and kills certain bacteria that cause diarrhea. Uses traveler's diarrhea, indigestion, and nausea. 3. Diphenoxylate and atropine, Lomotil. Mechanism: slows intestinal motility, uses more severe diarrhea. 4. Octreotide mechanism: reduces the secretion of fluids in the intestines, uses diarrhea caused by certain conditions like tumors. Next class to talk about is antiemetics. This diagram illustrates the mechanism of action of antiemetics 1. Vomiting center located in the brainstem. This center integrates signals from various areas to induce vomiting. Receptors involved H1, M1, NK1, neurokinin 1, and 5-HT3. The vomiting reflex can be triggered by signals from the gastrointestinal tract, the vestibular system, or the chemoreceptor trigger zone, CTZ. 2. Chemoreceptor trigger zone, CTZ. The CTZ is located near the vomiting center and detects toxins in the blood. Receptors involved D2, NK1, and 5-HT3. This area responds to chemical signals. 3. Gastrointestinal tract and heart. Mechanoreceptors and chemoreceptors in the gastrointestinal, GI tract and heart can send signals directly to the vomiting center via the vagus nerve receptors involved. 5-HT3, which detect changes in gut motility or irritation and relay these signals to the vomiting center. 4th, vestibular system, inner ear, responsible for balance and detecting motion. Receptors involved, H1 and M1. These receptors send signals to the vomiting center when the balance is disturbed. 5. Central nervous system. Higher brain centers, including the cortex, thalamus, and hypothalamus, are involved in vomiting due to stress, anxiety, or classes of antiemetics are 1. Serotonin, 5-HT3. Antagonists, examples, ondansetron, zofran, granisetron, chitril, palonosetron, aloxi. 2. Dopamine antagonists, D2, receptor antagonists, examples, metoclopramide, Reglan, prochlorperazine, compazine, droperidol. 3. Histamine, H1, antagonists, antihistamines, examples, diphenhydramine, Benadryl, meclizine, antivert, promethazine, phenergan. 4. Muscarinic, M1, antagonists, anticholinergics, examples, scopolamine, transderm scop. 5. Neurokinin 1, NK1, receptor, antagonists, examples, aprepitant, emend, fosaprepitant. 6. Cannabinoids, examples, dronabinol, marinol, nabilone, sesamet. 7. Benzodiazepines, not direct antiemetics, examples, lorazepam, Ativan, diazepam, Valium. 8. Corticosteroids, not direct antiemetics, examples, dexamethasone, methylprednisolone. Next class to discuss is antispasmodic drugs, work by reducing the excessive contractions of smooth muscles, typically in the gastrointestinal tract. Classes and examples 1. Anticholinergics, hyoscine, atropine, hyoscyamine. 2. Direct smooth muscle relaxants, dicyclomine, mebeverine, peppermint oil. 3. Calcium channel blockers, pinavirium, verapamil. 4.PDE4 inhibitors, ramosetron. These classes and drugs are used to manage conditions involving abdominal cramps and spasms, such as irritable bowel syndrome, IBS, and functional gastrointestinal disorder. If you find this informative, please like, subscribe, and share.